Hello, my name is Jessica Zamora, and this is my presentation on Community Windshield assignment. Pull this up right here. So I did mine where I'm currently living. I'm living in Redding, California, which is located in Shasta County. Through this assignment, I was better able to assess the new community I'm currently living in. I moved here over the summer, so I really had to do a lot of research. Redding is known mostly for its beautiful outdoor activities and has been called Trail Capital of California, the second sunniest city in the United States and home to Bethel Church, which people over the world travel to come and visit and attend their ministry school. And it is very hot out here during the summer. It'd get probably high as like 120. I come from a desert and it's way hotter than the desert. So the two communities I have chosen are Redding and Anderson. They're both within Shasta County, but probably about 15-20 minutes apart. So we will first talk about Redding. Redding is in the county seat of Shasta County, California. It lies along the Sacramento River and is the largest city in Shasta County. There are some newer homes, such as townhome communities built not too long ago, around the 2000s. And then they also have older homes that were built even further, probably early 90s, even really back to 100 years ago. And there's also many trailer homes. The median household income for Redding is $43,000, and the median property value here is $225,000. I will say there's also many beautiful communities over here where the houses are a bit private and along the river. So Redding has a population of about 90,000 people, with the median age being 38. The largest percentage of race is Caucasian, and which is very true. I hardly see anybody else other than Caucasians here. During my time here in Redding, I have seen and heard that there are many transients that pass by. There's also a huge homeless population, most under the age of 30. Heroin along with methamphetamine is a drug of choice. I work in the emergency room in downtown, and I see lots of meth users, lots of heroines. The whole transient thing I haven't really seen, but as I drive along the freeway, I see many people who they don't necessarily look homeless. They have many things with them, like a backpack and pretty nice clothes, but you can tell they're just kind of passing along or trying to get a ride to somewhere else. But there is a big population of homeless people out here as well. And then I kind of broke down population by race out here. Obviously Caucasian at 85%. You don't see a lot of Hawaiians. You don't see a lot of African Americans. Hispanics are the second highest, but I hardly see any Hispanics. I'll probably see, I can count how many times I've taken care of a Hispanic out at work, like twice, and I've been here for a few months already. So services, the neighborhoods I currently live in, the neighborhood I currently live in is in a neighborhood park that is clean and safe. Other publics are not as safe. Other public parks are not as safe. And you can tell when you drive by, there's a lot of homeless and transient people hanging out there. It's not well kept as well. People use their own motor vehicles for transportation. There's a public transport that's available as well, like buses. Uber and Lyft, I thought I'd just add that in here because in conjunction to like LA area, which is where I'm from, Uber and Lyft are available, but not as readily available such as those in bigger cities. The city offers many homeless shelters. There are 2 hospitals located centrally. And those hospitals offer many things such as chest pain, stroke. We do have a level 2 trauma hospital out here as well. Bethel is well-known church out here that offers its own ministry school. They also have just like general education. There's also a lot of local schools throughout the community, a local college, and a private Christian school called Simpson University. There are small shopping centers and also a community mall. The town has many family-owned businesses that add charm to the city. So economics, the biggest industry for work in the county is with the county and the hospitals. Bethel Church also brings jobs to the community. As with every community, there is a wealthy population and as a poor population. The difference with Reading is that they have a huge transient problem, so they don't necessarily add to the population, but that is the problem. It is known that Reading is the 5th most dangerous city to live in the U.S., and poverty rate is at 18%. So I also heard that hotels are a big business out here as well, that provide jobs. Again, it's a very passing by town. There's not much between here and the border of Oregon. I think it's about 2 hours from the border of Oregon. So many people stop by, to get a hotel. There's also many people that come here for business, whether it's for Bethel or other things. So the hotel industry is really big out here as well. So now I'm going to talk about Anderson. And again, Anderson is I'll talk about it more, but it's much smaller than Reading. And it's about 10-15 minutes from Reading, south of Reading. So 10 miles south of Reading. It has a significantly smaller population than Reading, about 80,000 less to be specific. So Reading's at 90,000, Anderson's about 10,000. Most homes in Anderson are distant from one another, giving that farm life vibe. They have some apartments and trailer parks. The air is crisp and the town has an outback vibe. Median household income is 32 and median value is 157. Also, to say more about Reading, Reading has a lot of, as I said in the beginning, it's the state capital for trails. There's a lot on the outer skirts, nature and like hikes, and lots of people come and visit Reading just for that specific reason. So that's a huge service that they provide that many people come to visit, is the beautiful nature. So people of Anderson, as stated previously, Anderson is a much smaller town than Reading. The community is spread out more. From what I saw, there's not much homeless people in Anderson as there in Reading. The town seems more quiet than Reading as well. As I drove by, there weren't many homeless people. Things were much more spread out. Businesses weren't as close together. I mean, personally, if I was homeless, I wouldn't necessarily have somebody drop me off in Anderson because there's not much to do versus Reading. You have a lot more people, a lot more community. So I think that it's probably why they don't have as much of a homeless population. There are definitely more females than males. And again, lots more Caucasians than any other race. So again, very small town, things are very spread out, but they do have one local park, and it looks pretty clean and upkept. Many people appear to use their own vehicle to get around. I did not see any public transportation. There was one right when you enter the city, but not not public transportation to get around the city. It seems like it just kind of drops you off in Anderson. There are a few Christian and Catholic churches. 4 schools are located that offer services from children to adolescents. And then it seems like they use the community college in Reading, for college. There is one central market that has a Walmart. It has a few other stores, but nothing big. They don't have a Target. A few fast food places, but not many. They have a Starbucks. And they also have a casino called Wind River, which many people go to, even people from Reading or Chico or surrounding cities. So poverty rate is 24%, so it's a little bit more than Reading. Many residents find income from farming, providing resources for their community along with their neighboring communities. So Reading will get a lot of their resources as well, fresh eggs or whatever. This Nash pumpkin patch is something I went to over October, and it's a farm there, and they have corn mazes. They obviously have pumpkin patch. They have, the inflatable things for the kids to play on. So they do that every year, and they charge for parking and stuff like that. So I'm sure they make a good income from that. And throughout the year, seems like many travel to work. They don't necessarily work in Anderson, but they work in neighboring communities like Reading or Red Bluff. Red Bluff has a hospital, which is about probably 15 minutes from Anderson. So for health problem issues in each community as found in Healthy People 2020. So for Reading, a big thing out here is mental health. So to improve mental health through prevention and ensuring access to appropriate quality mental health services, that across the board seems like a problem, not just here in Reading. There aren't many services that provide, even working we are, we often have to find placement for many of our mental health patients. Reduce substance abuse to protect the health, safety, and quality of life for all, especially children. There's a lot of drug use out here. I work in downtown, and supposedly one of my coworkers said when they got off of work, they saw somebody just using, just shooting up heroin like right on the street. So prevent unintentional injuries and violence. There's a lot of rape, unfortunately, in Reading. One of my coworkers is part of the SART team, so she educates a lot on women protecting themselves when it comes to Reading, because there's a lot of rape. And then we often get people coming in for STD checks. Again, the homeless population just rambunctious and stuff, and so even among the teens, and I think that's really everywhere, promoting healthy sexual behaviors. A lot of young moms out here as well. So in Anderson, improving the health, function, and quality of life of older adults. A lot of them out there are non-compliant. One of the stakeholders I interviewed stated that a lot of his friends don't understand the importance of following up their doctors and taking their medications. They just kind of eat whatever they want. So that was something important. Improve access to comprehensive quality healthcare services. There's not a hospital nor really a clinic in Anderson. A lot of stuff is just done here in Reading, and I think it'd be kind of important, especially for those older people that can't drive as far. It's not that far, but for them it might be a little bit farther and inconvenient. To ensure that federal, state, tribal, territorial, and local health agencies have the necessary infrastructure to effectively provide essential public health services. Again, kind of goes hand in hand with to improve the access to healthcare services. Improve mental health through prevention. Same thing, mental health is still a problem there. They still have some homeless people that have mental health issues. So community resources, obviously Reading has a little bit more resources than Anderson's, but they do have 2 major hospitals, a major commercial marketplaces. Bethel Church is a great community resource. Homeless shelters are really great out here, and different support groups. They have a lot of support groups actually for it being such a small town. And then Anderson outsources to neighboring cities such as Reading or Red Bluff or even Chico. But within their community, do have some homeless shelters and local churches that help. Both communities have their own strength. Reading has a bit more to offer as far as resources and opportunity for growth. With that said, Reading acquires more of a population than Anderson. Anderson's can be a safer place to live when it comes to that idea. Reading houses more of the homeless and transient communities because it's a bigger city. It's just, that's what comes with it. Reading hosts many local events, bringing the community together, as well as Anderson. Reading also provides beautiful natural parks that many come to visit. Along with Anderson, the small town vibes allows the community to constantly connect. And that's something I found even moving out here, is that I'm always hanging out with friends versus, trying to do something other than human connection. There's a lot of connection with the community. So through my stakeholders, I just kind of quoted things that were important. So Jennifer D. said, who is, she's going to the Bethel Ministry School. Reading is a small town with a lot of potential. When I first came out here, I was scared, as it's known it's a dangerous city to live in. But through Bethel, I understand is my calling along with others to impact the city through what God called us to do. Gretchen, who is part of the Shasta County mental health team. There are many residents of Reading living on the streets with mental health issues, most issues that were drug-induced. I'm fighting to provide better outcomes for these types of patients by vowing for more mental health resources. She's actually trying to get a mental health building out here to help those mental health because they don't have anything. Terry Kay was an 80-year-old man that was a patient of mine that was from Anderson. And he states, most of my friends don't understand the importance of upkeeping with their health. I try to tell them, but no one seems to listen. And then Tom B. is he's a pastor from one of the local churches in Anderson. Bethel Church in Reading really made our church aware that we can make a change in our community here in Anderson. We try to resource for those who need it. So a lot of small town vibes that understand, like, the residents in the city understand that they are what they make of the city. Any resources they're able to provide or whatever it is, they understand that they can make that change. So that's what's kind of cool about this little town is, everybody's trying to make an impact. So that ends my presentation. I hope you enjoyed it. And thank you for watching.